My name is Jose. I am CEO and founder of Unima. And we developed a technology which allows anyone to diagnose infectious diseases, even without any technical previous training, without the use of any lab equipment, directly at the point of care, and in less than 15 minutes and in $1 per each test. So this, I'm not sure if you can see this, but this is actually a city in Malawi called Ndeka. Ndeka is a very small community. It should have no more than 1,000 people, which is like 3 hours from the nearest urban area in Malawi. So this community has only one small clinic here. This clinic has only one doctor and 2 nurses. And normally they attend like 400 patients each day. So it's one doctor for 400 patients. This facility, of course, doesn't have a diagnostic lab. And actually, this small table on the left is their diagnostic lab. So they can only carry out like very simple and very easy to do diagnostic tests for malaria and HIV. And this is when they do have the materials to do it, because they depend completely on donations by Western NGOs. This is Porvenir, here on the left side. This is also a small community in the Sierra of Chiapas. This community has like 3,000 people living here. They have also just one clinic with one doctor and 3 nurses. This clinic gives service not only this small community, but also like 10 different small communities where people have to walk through the Sierra, going up and down of the hills, at least between 5 to 10 hours to go to the clinic and get attended. This clinic also, in this clinic, they don't even have any lab tests. So this is actually the only thing that they can do is have a table to take samples, blood samples, urine samples, or stool samples, and send it to the nearest hospital, which is in a city called Tapachula, which is like 12 hours driving from this community. So normally to have the result from a diagnostic, they have to wait between 2 weeks to 1 month. And at that time, in most of the cases, it's not very useful. So in Unima, we are working to solve the problem of access to diagnostics for more than 3 billion people living in the developing world. This is not only a very important problem, but also a very good business opportunity for us. So we are trying to solve the gap between what available diagnostic technology allows us to do right now and what patients living in this context need right now, which is diagnostics at a significant lower cost, which can give an immediate result in the first visit to the clinic, so people don't have to walk 2 days, one to the clinic and another one to get the results. And that can be used even in the most remote areas of the world. So our technology is based in a shark antibody produced by genetic engineering. So this shark antibody is called a BNAR, and it allows us to detect and catch specific biomarkers of each disease, being another antibody, being an antigen, a protein, or a toxin. So with this shark antibody as a central part of the structure, we build chimeric recombinant proteins using this BNAR to catch specific biomarkers for any kind of disease. So for example, we have a BNAR constructed to detect tuberculosis, another one for influenza, another one for HIV, etc. So this shark antibody allows us to catch the biomarker and to generate a signal which can be a visual signal or an electric signal. With this shark antibody, then we built the complete solution. So we use the shark antibody with the proper diagnostic device, which detects the signal that we are producing with the shark antibody. Then we use software in an app on a smartphone to evaluate the result of the test. And we use also a platform of data analysis to analyze on real time all this information that is being produced by the diagnostic device. Okay. So with this technology, we develop a diagnostic process which allows anyone to do diagnostics in 3 simple steps. So you take a blood sample, for example, from a finger prick. Then you put the blood sample in a paper device. You wait 10 minutes, and after these 10 minutes, you take a picture with an app in a smartphone, and you get the result like in 3 seconds. All the process can be done completely outside of a Wi-Fi or cell connection because all the process is being done on site. And all this information, when you have the result, is uploaded to a cloud server. When we store all this information, and we can use it for epidemiology purposes, for example, for real-time disease surveillance, and also to create analytics that can help governments or NGOs to create better strategies to stop disease outbreaks. So this is a technology developed specifically to solve this problem in limited resource settings, mostly in the developing world, but can be also used, for example, in resource limited settings in a high-income country like the US. So this is a test that allows people to do 15-minute diagnostics at $1 per test. It can be used by people without any technical training, so it's being built to be used by doctors and nurses, community health workers, or even the same patients. It can be used in very remote areas because you don't need electricity, you only need your smartphone, your application, and a piece of paper, and it can be also work without any phone signal. And for example, a very interesting thing is that this is a platform technology, and we can create other applications for new diseases in 3 months, and with a cost under $10,000 per each new test. So it allows us to create new tests at a very high speed. Right now, for example, we have developed applications for diagnosing tuberculosis, HIV, and influenza. The tuberculosis and HIV test has already been tested in preclinical trials, and right now they are in clinical trials for registration. We have in the pipeline new tests for influenza, dengue, chikungunya, Zika, sexually transmitted diseases, and some tests for animal health diseases. And we are working with 5 government hospitals and 2 research centers in Mexico for clinical trials, and with an NGO in Ghana and another one in Kenya. And the first product will be in the market next year, by the end of next year. Let me see, this one. So I will go very quickly in 3 of the different applications that we're working right now with early adopters of our technology. The first one is this tuberculosis and HIV test that we are working along with Partners in Health. It's an NGO from Boston. They have a group of clinics in Chiapas in Mexico, Heart Africa, another NGO located in Salt Lake City, and Access Afia is they are working with several clinics in Nairobi. So here the goal is to deploy these devices in all of the clinics of these groups and have feeding real-time information to the cloud server and sending alerts of diseases directly to the local office and to the headquarters of these NGOs in real time. Also, we are working with the Carlos Slim Foundation, something very similar to the Gates Foundation, but for Latin America. With them, we are working, developing a test, a differential test for dengue, chikungunya, and Zika that will be deployed in Mexico and Central America in hospital clinics and doctor offices in order to detect outbreaks of these 3 diseases and send this information in real time to the government and to foundations which are working in the eradication of these kind of diseases. And the last one is with Planned Parenthood here in the US. Here we are building a diagnostic device for sexually transmitted diseases. The idea is not only having the devices in the clinics, but also, for example, having the possibility of people going to the website, order directly the device on the website. It will be sent by FedEx to your home. You can do the test at home, and the result will be sent to the nearest clinic of Planned Parenthood, so they can give you the result and the treatment at the same time. So in Unima, what we are working is trying to solve a big problem, which is also a big market opportunity. And we are talking about 3 billion people in at least like 20 different diseases that can have a huge impact in the health around the world. But also we know that we can increase the possibility of people living in poverty to survive the diseases as important as, again, tuberculosis, HIV, malaria, influenza, Zika, but also to increase their quality of life.